So I'd now like to just describe the CASP appraisal checklist in more detail, and we're going to use the checklist for a randomised control trial as an example. So generally the CASP checklists contain a few starter questions, and they generally allow you to look at the validity of the study. So that's how well the study does what it says it's supposed to do. The CASP checklists allow you to think clearly about what the results are trying to tell you and how well the results have been reported. And then, as I said, it allows you to come to a conclusion about the overall usefulness of the results. And the checklists allow you to do this in a systematic way. So the way that the checklists are set up is they typically start with some screening questions. And those screening questions are really there to help you to decide how much time to spend reading the paper. So if the specific paper that you've got in front of you, if it doesn't pass those screening questions, then really it's not worth reading. And then the checklists typically go on to contain around 8 detailed questions, and these are questions you will ask yourself about the paper. So if your paper passes the screening questions, you go on to answer the detailed questions, and the detailed questions differ depending on the different study design. So we're now going to use the randomised control trial checklist as an example to help you get used to using the CASP appraisal checklists. So before we start looking at the checklist, just a reminder of what randomised control trials are. In a randomised control trial, participants are randomly allocated to either receive an intervention, which is a treatment group, or to be a control. So an example of a randomised control trial would be a study to evaluate the effectiveness of school children drinking fluoridated milk in school at reducing dental caries. So you would have 2 arms to the study. You would recruit school children, and they would then either have fluoridated milk at school, or they would have, as a control group, perhaps just have milk but with no fluoride added. And you would follow those 2 groups, and you would look at baseline, what the levels of dental caries are, and you would then follow them over time, and at the end of the study you would assess again to see what the caries levels were in the 2 groups, and you would know at the end whether differences between the control and the intervention group were due to receiving the milk, and then you would be able to come to a conclusion whether drinking fluoridated milk is effective at reducing caries. So randomised controlled trials are one of the best ways of evaluating the effectiveness of interventions. So let's look now at the CASP checklist for randomised controlled trials. So the way the checklist is set up is that you have, as I said, the screening questions, and they will help you think about whether the results of the trial are valid. So the first screening question for randomised controlled trials is, did the trial address a clearly focused issue? So when you're reading a paper that describes a randomised controlled trial, what you want to be very clear about, and what this first question addresses, is whether the trial, it's obvious exactly what the trial was addressing. And we use the acronym PICO to help us. And the P stands for population, the I stands for intervention, the C stands for comparator, and the O stands for outcomes. So to answer this question on the checklist, we want to be very clear that the paper describes the population to be studied, what the intervention is, what the comparator group is, so the control group, and what were the outcomes. So for example, the population might be school children, the intervention might be fluoridated milk, the comparator might be either no milk or milk with no fluoride in, and the outcome in that case would be dental caries. So that's the first question. The second question is about trying to look in the paper to see whether the participants, or how the participants were allocated to either receive the intervention or the control group. Because it's important in a good quality randomised control trial that details are provided about how participants were allocated. So you're looking to see whether they described this, and you're also looking to see whether the paper describes whether the participants and the study personnel knew who was randomised to the intervention group and who was randomised to the control group. And we'll discuss a little bit more about that, which is called blinding, or a little bit later in this tutorial. So when answering question 2, you need to look in the paper, look in the method section to see whether the paper describes how participants were allocated. And typically you will find some descriptions in the method of a good paper that describes this in more detail. So the third screening question is about what we might call response rate. So this is to have a look to see whether all of the participants who entered the trial were properly accounted for at its conclusion. So when you're looking for this, looking in a paper, we like to see what's called a consort flow chart, which describes exactly who was recruited, how many people were recruited, how many participants dropped out, when they dropped out, and ideally why they dropped out. And then we need to see it very clearly written in the results whether participants were analysed in the groups to which they were randomised. And sometimes we call that intention to treat analysis. So those are the 3 screening questions, and that will help you decide whether it's worth continuing to appraise a paper or whether it's time for the paper to be recycled.